Good morning, Professor Shi, Professor Krohn, and Professor Zhao. Thanks for the organizer for us can have the opportunity to share the experience and the ideas in this meeting. I'm from Zhongshan Hospital of Fudan University. Today, I'm going to talk about the standardization of graduate medical education in China, challenges and strategies. Before the talk, I just continue with Professor Zhang's morning talk. You know, China has the largest population in the world. 3 years ago, the Chinese government accredited 559 resident training base. Just from this morning, I learned the government is trying to expand the size of the training size to about 1,000 a year. 1,000. So, you know, each year we train resident about 70,000. You can imagine for 500 training bases is less. The training volume is too high. So that's the problem. But now the things change rapidly, I think. Today, I'm going to focus on 3 areas. The first is education continuum. The second is training quality and accreditation. And the third is alignment with the changes of the healthcare. First, you know, due to variety of reasons, there's the education system in China is very complex. You can see for the undergraduate medical education, we have 4 years, 5 years, 6 years, 7 years, and 8 years. Even for the 8 years program, we have a different curriculum, varies quite a lot. For the graduate or postgraduate medical education, we have a very diversity. Some directly go to the resident training after graduation from the medical school. Some go to the graduate school. After 3 to 5 years graduate study, then go to the resident training. So it's very complex. After 1 to 3 years, they go to subspecialty training. That means if you look at the background of the applicants for the resident training is huge, huge diversity. 5 years bachelor, 8 years medical doctor, master, PhD, and professional doctor also, with different working experience. So different undergraduate medical education and also graduate medical education is not in the same level. For example, before the year 2010, many medical graduate students go to the small hospital directly under the training of the small hospital and the teacher and practice in the small hospital. Maybe some of them will go to the big hospital like PUMC, Zhongshan, and Xiehe, Huaxi hospital. It's a big hospital, it's no problem. They have a very good training system. But in small hospital, it's totally different. The standard and also the quality is low. That's the problem we are facing. That's also the reason the Chinese government to set up the national standardized resident training program in the whole country. You know, in the past several years, there is a trend in medical education for the from the time-based, procedure-based to the competence-based education. Since 3 years ago, the Chinese government set up the structure in all the more than 500 training bases, including with very clear goals, plans, and also the human resources and the infrastructure, etc. And the most important thing is the process, how we educate and train our young residents. That's a big issue because, for example, in our hospital, we see patients each day, about 15,000 patient visits. Is huge. You cannot imagine in United States or Europe. The problem is the quality of the physician in small hospital and the community hospital is low. The patient does not trust the ability of the physician in the small hospital. That's the problem. So we already want to, the key is the quality of the training. If we train a very competent residents, maybe several years later, more and more patients can see the doctor in the nearby hospital. That's the way we are moving forward. So the process is very important for the training. And also, we are already assess the outcome of the training program, like the competency of the young physician. We have 5 core competencies in Chinese residents, like knowledge, skill, professionalism, communication, and also teaching and research. Nowadays, everything changing rapidly. Big country has big problem. The aging problem is the same. Knowledge expands exponentially, and published or perished atmosphere is very, very apparent in obvious in many big hospitals. The teachers just want to publish paper and want to apply for more research grants, and also have no time. I mean, productivity also important. How many patients you see, how many operations you perform. So rapid advance in medicine. I mean, the knowledge, technology outgrow the education system. That's the biggest challenge we are facing. Evolving healthcare needs and also important. In our hospital, for example, we want to change this atmosphere. We make a special policy to guarantee the faculty committed to the training, they will get compensation from the loss of the time spent on the training. So it's very important for the training quality. Here is an example. You can see there is another problem between the rural area and the city. You can see each year the many graduates. This is a figure published data from the lesson 2010. You can see there are many graduates from the medical school and the university. Only 50% of that go to the hospital. The other part go to the graduate study and the other specialty. So the situation is even worse in the underdeveloped area and the rural area in China. That's the government need a very hard work, incentive to improve this situation in the future. Changes in medical care offer opportunity for the medical education. Our curriculum, in many medical universities, is out of date. The knowledge is old. The basic science and the clinical stuff is not integrated very well. So anyway, the new time brings us opportunity. We can improve this education through sharing experience and improve the way we educate our young medical student and resident in the future. Hopefully, we can integrate the new advance in biomedical science with medical education, addressing the multiple societal factors, including high cost health disparities in quality of care, and deficits in patient safety. Thank you for your attention.